Hey, Mike Jackson with Adobe Systems, and I'm here in Chicago for the 2012 Accountable Care and Health IT Strategy Summit, where Adobe is a proud sponsor. I'm joined here with Dr. Bala Hota, who's the Chief Information Officer of Cook County Health and Hospital Systems.
And we are very busy. We have over 120,000 ED visits per year. We have the busiest emergency room in the city of Chicago. Greater than 200,000 ambulatory visits, over 100 distinct ambulatory clinics within our network. We have two main hospitals, Stroger Hospital and Provident Hospital, on both the west side and the south side of Chicago.
Something that I found very fascinating was you said that true re-engineering involves the evolution of care coordination and health IT systems as well as workflows. Can you speak to ways that you are addressing each of those related to the expansion of Medicaid as a result of the Affordable Care Act?
Sure. Well, the Affordable Care Act and meaningful use, I think, are two sides of a coin. And we have spent a lot of time trying to implement new processes and tools in our electronic record for meaningful use. But I think now we're looking at the other side, which is how do we re-engineer the workflow so that it's more efficient? The electronic record, it lets us make sure that key care quality measures are being accounted for, and also key workflows can be supported. But it's a platform, and the workflow changes that we can support. I think that's the next step. So from an IT perspective, there's some tasks that we have to do to be able to meet these requirements. We have to be able to enroll patients. We have to be able to impanel them, and this is actually a big thing. We have to unambiguously know for any single patient who is the provider and who is the medical home for that patient. Now, in broad strokes, we will then receive a per member, per month payment for each enrolled person to cover the cost of care. Essentially, we'll be adopting the risk and adopting a managed care type of an environment for patients. In exchange for that, we have to monitor the cost and quality of care for these patients and develop a network to provide care.
Because we all know, regardless of how much is invested in these systems and technologies, unless the intended audience actually uses it, it's useless. So what are your thoughts on user experience and addressing that as the front end of all these advancements?
Yeah, well, I think we've made a lot of progress with user experience. The software tools that are available have been really improved a lot over the last few years, but I think there's room to improve even further. I think some of those changes are even things down to how many clicks it takes to drill through the chart. Empanelment is the act of assigning a provider or home for a patient. Now, this has to be patient-friendly as well. They have to be able to enter from a clinic, say that they have a provider at a particular clinic. They also have to be able to, from the third-party administrator, when they enroll, have that assignment made if they have it. They have to be given the option to change. It's basically what we all do with open enrollment periods. But this is starting from scratch, and this has to be now available to this Medicaid population. But 2013 will be another year of change. We have ICD-10 coming up, we have Meaningful Use Stage 2 coming up, and then we have to really improve user experience, because as we upgrade our electronic health record, the docs have to be able to do, and the nurses have to be able to do their jobs without a lot of pointing and clicking. So far, we've found this to be a great opportunity for our health system. We have a chance to re-engineer the kind of care that we give to really be patient-centered. Patient-centered based on the home that the patients are in, right, as well as trying to improve the care and quality that we provide for patients.
Well, at Adobe, we're really big evangelists of three parts of experience, and that is engagement on the front end, maximizing efficiencies or optimizing efficiencies behind the scenes, and then measuring that effectiveness throughout. And it sounds like you're well on your way in addressing each of those core competencies of the overall experience. So thank you so much for your time today.
Thank you.
I appreciate it.
Absolutely.